Is this supposed to help maintain hair forever? This is a great question. Anything that we use on our heads to counter hair loss, we would hope that it's going to last forever. The unfortunate thing is, though, however, is because it's genetically derived, the issue that is androgenic alopecia, unless you flipped those genetics off and they stopped interacting with your body, or they stopped predisposing you to having this issue, it's going to be very, very hard for you to create something that is ever going to have long-lasting action. As we know, even things like vaccines require boosters, down the track. So what this particular drug, GT20029, has shown is that you can apply it twice a week and get great results over a 12-week period, which is a very short time frame. They have not yet, though, highlighted what the maintenance is like. So can you drop that back to once a week after you've been using it for 52 weeks or a year? Do you have to increase it because you build a bit of a tolerability, or you get a bit of a plateau? That has not yet been highlighted. It's only going through phase 2 trials. They're currently in the process of launching the phase 3 trials. Haven't found much more about that yet, but in China, they're looking to do the phase 3 trials as we speak. But I would predict, as a hair loss doctor and having studied science through uni, I would predict that this is going to require some degree of maintenance. Whether that's an increasing level of maintenance, like we see with other hair loss drugs, you end up having to stack them because you don't get the same results ongoing or forever. You get to a bit of a plateau phase and things tend to drop off a little bit. Some people regress, so you have to add another things into the mix, and that's what we know is true of medicine, unfortunately, not just hair loss. So likelihood is that you're probably going to have to maintain this forever. Yes. How do you maintain it? Well, we're going to find out in time exactly how this particular drug interacts with other drugs. When you stack them, is there a very good synergy between them, or do they cancel each other out even? So we'll learn more of this in time, particularly in the aftermarket trials. If it does go to market, that's when we really find out a lot in the phase 4 or aftermarket data. So that's that question wrapped up. My prediction is that yes, you will have to do this forever as long as your hair matters to you.